As a young lady, before you visit the gynecologist or your family physician, there are a number of informations that, as a matter of fact, as a matter of necessity, you need to arm yourself with these informations, and I will go straight to what they are. It is specific to you being a lady. Number one is your last menstrual period, the date you started your last menstrual period, not the date you finished essentially, but when they ask you of your last menstrual period or your LNP, is the date you started your last menstrual period. The second thing is the number of days. How many days does your menses flow for? That is number two. Number three, how regular is your menses? Do you see your menses every month? Or better still, what is your cycle length? Your cycle length is how many days interval between your last period and the next, or between two consecutive periods that you start. How many days interval is your period or is your cycle? That is your cycle length, which is a more appropriate or objective way of assessing you than how regular, in quotes, your cycle is. Number four or number five is how painful is your menses? Do you have painful menses? Number six, do you have heavy menses or light menses? Does your menstrual flow comes with clots? Another question, number seven or number eight, is do you have painful intimate activity? Apart from that, they also want to know, do you have mid-cycle pain? Mid-cycle pain, what people call ovulation pain. Do you have mid-cycle pain? Do you have symptoms around when you're about to start your menses? The pimples, the nipple pain, the tenderness or heaviness in the boobs, the lower abdominal pain, one-sided low abdominal pain, left or right-sided low abdominal pain, or just, pain in your thighs, waist pain before you start your menses. Some will even complain of headache. These are a group of symptoms that we'll call premenstrual symptoms or premenstrual syndrome. Your gynecologist, if he or she is meeting you for the first time, or if you are consulting him or her for the first time, wants to know, when exactly did you start seeing your menses as a young girl? How old were you when you started seeing your menses as a young girl? Want to know how many times you've been pregnant in the past, and what are the outcomes of this pregnancy? Was there a miscarriage? Was there an abortion? Was there an ectopic pregnancy? Was there a stillbirth? If you've gotten pregnant and you've delivered, want to know your number of children, want to know if all of them were through cesarean sections. If they were cesarean sections, was there an elective cesarean section? Was it an emergency cesarean section? We also want to know if you've had natural deliveries. If you've had natural deliveries. We want to know if you have abnormal discharge as a woman. Every woman has some degree of discharge that is normal for her. But your gynecologist, your family physician wants to know if you have any abnormal discharge as at the time you are presenting. If you do have abnormal discharge, what is the color? Is it foul smelling? Does it smell like fish, rotten meat, rotten meat? Any of those. Want to know the characteristics of the discharge if you do have abnormal discharge down there. Finally, we would also want to know, do you have abnormal breast milk discharge? These are informations that should be at the tip of your fingers anytime you are visiting your doctors, especially if you are going to the hospital to see a gynecologist or a family physician with a gynecologically related complaint or symptoms. Irregular menses, trying to conceive mothers, recurrent miscarriages. These are the questions that we want to ask. God bless you all. I will see you in the next video.